The order came in like any other: intravenous fluids, pain medicine, antibiotics, then the last one, 10 units of insulin intravenous push. I froze. It was 2:17 a.m. The ICU was quiet, except for the steady beeping of monitors and the occasional hissing of oxygen lines. My patient, Mr. Ahmed, was a 45-year-old diabetic who had just undergone emergency abdominal surgery. He was post-op, drowsy, but stable. His blood sugar was 172, higher than normal, but not dangerously so. I read the insulin order again. It didn't make sense. 10 units for push. That was too much, too fast. And for push, insulin can cause a blood sugar crash in minutes, can cause hypoglycemia, seizures, cardiac arrest. I double-checked his chart. No signs of diabetic ketoacidosis. No standing order for this kind of insulin dose. No previous documentation that justified such an aggressive correction. And yet the physician had signed it. I was a second-year ICU nurse. I had been taught to respect physicians, but not to be a robot. My inner dialogue kicked in. What if I'm wrong? What if I delay life-saving treatment? But my gut and my training said, this order is unsafe. I paged the resident. No reply. I tried again. Still no reply. I turned to the charge nurse, quietly explaining what I saw. She nodded, came with me, and we called the on-call He answered after a few minutes, sleepy and annoyed. But when I explained the order, his voice sharpened. Cancel that. That was a mistake. A mistake. If I had followed that order blindly, Mr. Ahmed Mitov coded in minutes. I looked at him again, breathing softly, unaware of how close he'd come to danger. My hands were still slightly shaken. It wasn't the first time an order had raised a red flag, but it was the first time I had nearly followed one out of fear of overstepping, fear of being wrong, fear of offending a doctor. But that night taught me something permanent. Nurses are not there to blindly follow. We are trained to think, to question, to protect, even when it's uncomfortable. The next morning, the resident found me and simply said, "Thanks for catching that." No apology, no explanation, just acknowledgement. That was enough, because this job isn't about ego, it's about accountability. We are the last line between a human body and a deadly error, between a missed heartbeat and a miracle. And if that means pausing, questioning, even pushing back, I'll do it again and again. Because patients don't need obedient nurses. They need thinking ones, learning lessons for healthcare workers. Orders can contain mistakes. It's your duty, not disobedience, to question anything that doesn't align with patient safety. Your voice is not a threat, it's a safeguard. Speak up, even if it feels uncomfortable. Interdisciplinary respect means collaboration, not silence. Learning lessons for medical and nursing students. Learn the why behind every order. Don't just memorize, understand. Nurses are not subordinate. They are accountable professionals with the right and obligation to advocate for patients. Early in your career, confidence will feel like rebellion. It's not. It's responsibility. Learning lessons for the public. Behind every prescription or procedure, there are layers of decision-making. Nurses are critical thinkers, not assistants. When a nurse questions something, it's often to protect the patient, not to challenge authority. Trust the nurse who pauses. That pause might save a life. Closing reflection. That night, I learned that silence can be deadly, but speaking up can save a life. Nursing is not obedience, it is accountability. Patients don't need us to follow blindly. They need us to think, to question, and to protect even when it's uncomfortable. This is Silent Scrubs, where every story carries a lesson for healthcare workers, students, and the public. If this story spoke to you, subscribe and join me as we uncover the unseen truths of hospital life.